for it? Is it right? Where do you go with it? Whether it's, a 9-month-old, you try to pull them up and their head is just hanging down. So it's head lag. Well, we know head control happens by 2 months. Or 3 months. So we know that then there's a problem, and to go searching for early intervention. So that's why I had you do those things. So this week, we're going to do chapter 34, 35, and it's school age and it is adolescence. And I'm going to go over those things you need to know. Talking about Erickson Kohlberg, it's more Erickson when we talk about school age and the adolescent. So I'll be giving you some examples to help you again with that. I know that this quiz did have questions on the theorists, and I know you went, oh, now what do I do? And I know it's hard to understand them. I think it's just one of those mind openings. Okay, I need to do something. That's my deficiency. I know the other answers to the other types of questions, but I need to seek more information, whether it's reading your book, whether it is doing a YouTube video, or getting, some resources from your LRC. So
you mentioned YouTube video. Where can I, what YouTube video are you speaking of that will give me
I haven't looked, LaShawn.
Okay.
But what I will do is I'm going to start to look for one. And if I find something that I think is really good, I will post them so that you
I kept getting them confused very much.
Absolutely. Absolutely. I know as a teacher in the beginning of teaching it, I didn't have this when I was in pediatrics. They didn't do thing about theorists and evidence-based practice. This is the evolution of nursing and how we've really gotten strong. And what we do now is the best practice, not different practices in all different hospitals. And for instance, and I'll give you an understanding about best practices, Foley care. One hospital wanted you to use betadine, soap and water and betadine when you were done. Another hospital, just soap and water. One wanted the Heba cleanse or another cleanser. Now we know it's soap and water, in the morning with AM care and once a shift. And that's all we need to do. And that's through practice, through research, we've found those things. And that's what nursing has gotten to. Know that this week we will be doing our reviews. They're on Tuesday, Wednesday, and Friday. I've posted the times. It's me starting tomorrow. You will get every recording. All the recordings do come to you. And every time I post the recording, I always again post the PowerPoint so that you're not looking, where's that PowerPoint? It's just like when I post your about the recordings for the class, I'll always post the PowerPoint so that you don't, aren't out there looking. Now, I did make a YouTube channel. It is Professor Bogart's Pediatric Nursing. You will see every class now posted. So Monday, you'll see an M 3 to 5, it's your class. You can go in there and look at it. This way, I'm never hearing things like it wants a password. Oh, it's not opening. It's not working. Those are things I hear. And I know this YouTube channel, I haven't heard any complaints. And in it, under the information, I always put the Kahoot link to. So you have it there. Last Thursday, I did a dosage calc review, and I handed out some worksheets. I did send them to you, and I did go over most of it in that dosage calc review if you have any problems or understanding. Now, I do not do dimensional analysis, but I show you how to pick out the numbers you need a lot easier. I show you what those numbers mean and how to put it. And actually, the way I do is very simple. I'm not trying to change the way you do it. I'm just trying to give you information, maybe helpful information. And I want you to know that at the end of the review, the students were like, yes, this is exactly what we needed, because it's really foolish to lose 2 points per question on calculations when they can be so simple. That's 10 points on your exam. We don't want to lose that. So next week, come to class, be prepared to take the exam first. I will open up the Zoom at least 15 minutes beforehand. Just show me your ID. you need to have one piece of paper and a pencil, and I need to see a side view, and we'll go over that next Monday. I usually get started pretty quickly, about by 5 after the hour, and then I have you come back for a Kahoots on the information of what week 4 is all about. And over the Kahoots, I'm actually explaining things a little bit more. So all the key things you need to know that you will get, okay? Now, I will give you the PowerPoint. You can look over it. You have your interactive PowerPoint, then you have the Kahoots to look at too. So everybody who is off camera right now, I know one person who's asked permission. Does anybody else need to ask permission to be off camera? Tara, is it cold outside where you are right now?
Yeah, a little bit.
Yeah, it's cool down here today also. We had to put the heat on a second. I'm like, wait, turn that heat off. I don't like heat. Just, I'll put a shirt on. It's okay, not a problem. Get out of my tank
It's too
top.
loud in the house. Everybody's talking and I can't concentrate.
All right. Well, then you're smart to do that. I've got a nice porch too. I enjoy it. Okay, here we
Ms.
go.
Bogard, you want me to
Yes.
write you? You want me to send you a message? Ms. Bogard, you want me
Okay,
to send you a
Tish, that's
message?
fine. Yes. Yes,
You want me
would you
to-
do that for me? Just send me a message in the chat so I know what's going on. You don't
Did you
not
get
have
my
to tell the
message?
world. Yes, I did, Tish. Thank you so much.
Thank
You let me know if you need anything, okay?
Okay, thank you.
No, you're welcome. You know, whenever you all have any issues, let me know. I can work with you. Sometimes, you know, like right, for instance, right now, I have bad sinusitis. I had to take some Tylenol. My whole side of my face is swollen. This here up into my nerve, but I'm on day 2 of antibiotics. I had some in the house. I started them because I'll end up in a hospital if I didn't start them as soon as I did. My general practitioner is great. He says, so let me give you a prescription just in case you need them. So I have them at hand. So it's nice to be a nurse with respect from physicians. So anyway, here we go. Let's do our PowerPoint. I went over this again this weekend, making sure that what you have here is what you need. So school-age children, ages 6 to 12. This is actually part of my dissertation. I really explored them, and these children from even age 6 are able to very intelligently answer questions and have their own opinions on things. And of course, the 12-year-olds, they have their own opinion on things too. So school-age children, 6 to 12, starts with baby teeth and it ends up with their permanent teeth. So they grow quick. The thing is, their physical maturity does not meet their mental. So you might see a child who's 10 years old who looks very old and mature, but mentally they're not. So always remember their age when you're directing care towards them. So height is 2 inches a year, so 1 to 2 feet for 6 years, which is quite a bit. Their weight increases, their weight almost doubles because 6 to 12 is a long time. And at this time, boys and girls are still the same size. The boys aren't taller, they're not bigger. That starts about high school. When we go into school age, these children are becoming more graceful. They're becoming more limber. They know their bodies. They're able to play sports. They're able to walk without tripping and falling, and they're not waddling like the younger children. Their fat is diminishing. They're getting more muscles. We know all about the head circumference, has nothing to do with the chest anymore. And this is the age of the, all I want for Christmas is my 2 front teeth, because all their baby teeth comes out and now their permanents are going to go in. Their body systems become mature. You know, these children can hold their urine more than the younger children. Their heart's not the big in their chest anymore. It's becoming in more proportion. They've had many illnesses, many viral illnesses. They've gotten most of their vaccinations, so their immune system is a lot more effective. Their bones, where they were softer as children, younger children, become to ossify. So they crack and they break that way. That's why it takes longer for mending and
It's yours,
healing.
huh? What'd you say?
Let me see, Tish. All right, gotcha. So remember again, physical maturity does not correlate with the emotional or social maturity. Just because they look old doesn't mean that their heads are where you think they are. Now, their biological development, prepubescent, it's about 2 years before 13. So about 11 years old, they start with different changes in puberty. Now, girls mature 2 years earlier than boys. That's why there's an age where girls think boys are silly or stupid, because they're not maturing like the girls are. We know puberty begins about 10 in girls and about 12 in boys. Now, we know the first thing that happens in girls is they get their breast buds. And in boys, they get an increased testicles that starts to grow. That's the first thing on both of them. Now, how do you assess these children? Now, you're talking ages 6 to 12. So depends on what age you're speaking to. But if I was talking to a 6 or 7-year-old and I needed to do an x-ray, and if you've ever been in an x-ray room, there's this huge machine and it comes at you and these children could get scared and run away, right? But if we say, hey, it's a camera, and guess what? I can look inside of you. And when it's done, I'm going to show you that x-ray. So you can see that broken bone or see what your lungs look like and how big your heart is. When we're talking about abdomens, we're going to inspect it, which means look, always look first in children. Then we'll listen, pertussin, we'll palpate. We talked about it a little bit about the lymph nodes. Lymph nodes you should not be able to feel unless they're sick. So a healthy child, you feel nothing. Another assessment they do, part of the assessment, is the hypoglossal nerve, which has to do with their tongue. Now, you can even get an infant to stick their tongue out to do this. So hypoglossal nerves, they stick your tongue out and they, okay, it works. Another thing is how to assess the breath sounds. Now, there are upper airway and lower airway in children. You know, children get a lot of snotty noses, and sometimes you hear the rumble of the snot in the upper airway. Depends on where you put your stethoscope. So if you want to hear bronchial sounds, you're going to put it right over the trachea. Okay, and you're going to hear all of those bronchial breath sounds. If you want to hear the lower ones, you're going to go to the lower borders on the front and the back of the chest. Now, Freud and the school-age children. Freud is a time where relationships now are same-sex peers. They're not interested in girls with boys and boys with girls right now. They want girls, and they want to start to understand about sex. They have questions, and they'll ask questions, and they should be answered. And, you know, with using real terms, et cetera, but they don't know the exact thing. They think that, what was it? Christian asked his mother about sex, and he said, sex is when you sleep in the same bed together. Okay. Sure. Yes, it is. Okay. And that's okay for a 5-year-old, right? Erickson, they love to do things and do it well. And then they get frustrated when they can't. Okay. They want to be able to help mom cook in the kitchen. They want to be able to write the best in school or the spelling bee or the best at math. They all want those things. You know, they want to be able to do it by themselves, independently. They don't want you over their shoulders telling them all what to do. And if they do it well and one of their peers, you know, tells them, wow, that was great, that's what they want. They want their peers to say, hey, man, you did really good, you know, playing soccer and, you know, PE the other day. You kicked that ball really far, or you caught that ball and it didn't go in the goal. That was awesome. They love that. Senses of inferiority. So we know that they want to do things, right? Industry, they want to do things. Inferiority is when they can't meet what somebody else does. I just don't get math like these other people do, and they get frustrated. They want to do everything the best. And if they can't, they're going to feel inferior because they can't do it. You know, not everybody is athletic. Many people, they're, very, clumsy. So maybe they're playing the piano and cooking, and the other children, they could be in sports doing those well. So this is the time where they want to do stuff, peer approval, and they feel inferior when they can't meet what everybody else does. Piaget. This is the time where they start with this conceptual thinking. They start to understand the relationships between things and ideas. They're starting to know that a glass of water, if you pour it into another glass with a different shape, it's still the same amount of water. And they're starting to understand what they need to do to get what they want. So, like I said, the cognitive development, the water in the same glass, different glasses, still the same. You take a piece of dough or clay and you smush it, it's still the same shape, same amount of pennies, et cetera, et cetera. And that's part of the cognitive development. Kohlberg, reward and punishment. They know that if they do something, they're going to get either a good reward or a bad reward. This is not unlike the younger children, but they're always like, well, I really want to do that. Is it worth the punishment? That's the difference. The younger children know they did bad, but they don't do it because the punishment wasn't as bad as really wanting to do what they wanted to do. Okay, does that make sense? Their spiritual development, they're starting to think more about it. It's in concrete terms. They're learners. They want to see things, know Christmas, know, Rosh Hashanah. They want to know whatever the religion is, they want to know it. And they believe God punishes them when they're bad. I've had many a kid come in with an appendix into the emergency room, and they just said, but I was bad. I hit my brother. That's why my tummy hurts. And you have to say, something has nothing to do with you hitting your brother. I know you love your brother. And it actually, me saying that has, they relax. They know that, oh, okay, I'm not getting punished from God. That's what they believe. Punished from God because they did something wrong. Again, social development, peer groups are so important. And many children will switch their liking of a sport to another sport just to be with their favorite peer, their favorite friend. One child might like playing soccer, but the other kid wants to play football, and they'll say, all right, I'm going to go to football because my peer wants to do that. And that can influence them. Very, very strong influence. And we know that these peers, again, same-sex peers is the part of the social. We know at this time they're starting to form all sorts of clubs and peers and Girl Scouts and Boy Scouts and 4-H and whatever. And these are really important. But remember, in these little clubs, you have that child who can do everything and they bully. And there's always going to be, in any class, any profession, there's always going to be a bully. Relationships with family changes because now they have friends outside of the family, and they have to learn other attitudes, cultures, ways of expressing themselves with another culture, another family. So they bring their own cultures into it, but they're learning about other people now. They're starting to learn a little independence from their parents. They're now joining clubs, and they have to learn what they need and express what they need to the parents. And it's becoming breaking away, because what do children do by the time they become the adolescents and graduate high school? They go away, they go to college, or they move out, they get a job, whatever. So all of these things and all of these groups and clubs, etc., are preparing them for the ability to be independent and to move out of the house. So they still need mom, they still need dad, they're not a friend, they still need that good strict structure at home, they still need the punishments when needed, but parents are still there. Play, always play. They're What play teaches them is rules and rituals. And when you get into a job or you go to college, you have to do something, to get your grade or to be paid or to be praised by your boss. So rules and rituals in games are really important. Learning how to follow the rules properly and not that cheating, because that's life. We can do it with bunches of people. We can do it quietly alone. And it does, when they can conquer one of these plays, they feel good, whether it's cooking, whether it's reading, whether it's playing the piano, sports, it doesn't matter. You're starting to learn what they can do well. What do I do well? Is it, I was a ballet star by the age of 10. There was a whole big lineup of tap and ballet, and I was a little kid in the front of it doing the same things as the other one, because that was my ability, and it made me feel so good about myself. Adults do play a really vital part of it, whether it's the Nana, whether it's the aunt, maybe mommy or daddy's best friend, they can really make a difference in a child, positive or negatively. And at this point, they're starting to learn respecting themselves and to be more confident in what they can do, and they're being happy, and they're starting to know what makes them happy. They're developing a body image. They know that short hair, long hair, what do they want? Do they want it pulled back in the ponytail with a bow? They want it down and curly. They're all into what makes them feel the best. They're also knowing that everybody is different. And they also can see a child who maybe has to wear braces early, or has to wear glasses early, or hearing aid, or anything that makes them a little different. They're starting to notice these things. So when you start and you go into kindergarten, it is usually, if you've not been a preschooler into preschool, now you're into all of this structure. They have to be up at a certain time, get dressed a certain way, pack their backpacks, get to school, and they're expected to behave. Go, sit down, do this, do that. Now we're going to color, we're going to spell, we're going to read. They're going to start to have to follow somebody else in more of a strict, structured manner. And it's, again, getting them ready for their future. I mean, how do we prepare children to go to kindergarten? Well, we should be reading to them, and letting them looking at the words and stuff, and being able to talk about themselves, and, being able to tell the teacher what they need to tell them. Again, we know when they break away to kindergarten, we know that the peer relationships are important. I know my little Christian comes home, he's in preschool, he's 5. He talks about Santiago, his best friend, and what do they do in Santiago and Santiago. And that is the peer that he reaches out to. Nutrition, 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 nutrition never changes. Remember, children are growing from infants all the way up into adults, and the types of food they eat is really important. We know that there is games children can play to see, are they eating properly? Those My Plate. Now, My Plate is a website, and it shows all the food groups, and did they eat the proper food groups every day? Today, it's really difficult because you need 2 parents. If you're lucky to have 2 parents, both parents have to work. And sometimes it's easier to grab fast food and go home. And we know that's not always the proper choice. Now, a lot of these, going to fast food can lead to obesity, the heavier child, but it's not just the fast food. It is reaching epidemic proportions. And because why? Well, today, children have their iPads, computers, video games, phones, and they're sedentary. They're not up and out and moving like, years ago. TV, you can always find a cartoon or a kid show on. Many years ago, there was only Saturday mornings that you could watch cartoons. It wasn't, any time of any day. So what are they doing? They're sitting there in front of their iPads for hours and not getting out. So what are they doing? They're eating, they're not moving, they're gaining weight. Sometimes it's due to the neighborhood. The neighborhood's not a good neighborhood and you don't want them outside because it's not safe. And that could be part of it. But, it doesn't matter, the socioeconomic level of obesity. Every culture, every level of the community, all can have a child who goes into obesity. Now, what happens when you have a child, a school-age child who is obese? Well, they are going to have these cardiometabolic changes, it's called. And basically what it means, it's risking them for diabetes, hypertension, high cholesterol, because of this overweight as children. So how do we hope to correct some of these things? And what do we know about it? Well, we know that obesity should start when mommy's pregnant with a baby and right through infancy all the way up to where they are. All ethnic groups, as I said, all socioeconomic levels, don't matter. They all need to be told about obesity. It doesn't mean one culture or another, or one, lots of money, no money. No, it doesn't really matter. All of them need to be taught about it. And what they do is, in school-age children, they have all these programs, Dare to Keep Kids Off Drugs. And one of the other ones now is about, targeting obesity and teaching children how to eat as school-age children because they're so impressionable. And the other thing that we have found is when a child is done eating, okay, and, they have a plate that still has food on it, we as parents go, you need to finish your food or you can't get up. We do that. Well, if we always say you have to finish your plate, this goes right into adulthood, and what you're doing sometimes is just overeating because that food is there. So they shouldn't, within reason, tell these children to force them to finish their food when they're not hungry, because we know some days you're hungrier than others. Children are the same. Sleep and rest, 9 to 11 hours. We know the younger children don't want to go to bed and they're going to fight and yell and mommy and drink of water and I've got to go pee. I want another hug. Give me a kiss. All of that goes on, is it early? But as they get older, it's going to be easier to get them to bed. And then, of course, when they're at the high level of school age, they say, I'm tired, I'm going to bed, because they know that tomorrow will be a busy day. So exercise and activity are really important because it does help the body. Of course, it also helps with obesity, but it also rules of games and how to play and cooperate with other people. We know that there are issues with sports. I know that in Miami, we have very high competitive in football or soccer, whatever you want to call it. And the baseball, and these parents sit in the stands and they yell at the kids for missing a ball or not kicking a ball or missing the goal, and that can really ruin a child's ego. So making sure parents are there to help them through those things, because it happens. Even coaches do that. So being aware of what your child's going through. I mean, children love to be in competition and they love to win. They love to win. I want to do this. My little Christian said, yeah, and I won, right, Nana? And I won. Well, okay, sure, you win. Dental health is important. We know that this is all the permanent teeth coming out. The baby coming and now the permanent are coming in, and now they're all crooked. Now they need braces. And then you can have a child who falls down and a tooth pops out with a root. What are you going to do with that? This is a permanent tooth. Well, how do you treat that and what do you do? Well, you're going to put that tooth in cold milk. I believe it's the calcium in it. I'm not really completely sure, but it's proven better than water, anything. I think isotonic, hypertonic, and the calcium, I believe, is part of it. And you bring them either to a pediatric dentist or a pediatric emergency room. And they literally, I've seen the front teeth, they numb it, let it get numb, and then they push the tooth back in. So, and they do take, and of course, they'll be on soft food for a while. Again, as I said, sex education, it's curious, you know, just having the ability to speak to your children. You know, there is some sex education on, you know, young girls and getting their period, so they're aware of them in school. School nurse is always a great reference, but answering questions are really important so that children don't start looking for other children for answer. So your role as a nurse in sex education, it is normal. It is something that there's a question, you can give an answer related to that question, and know that you are there as a resource. A lot of children won't speak to their mom and dad about it. I know I would never go to my mom and talk anything about sex. I was lucky I could go to her and say, Mommy, I'm menstruating is what I told her when I got my period, because we didn't talk those things. So having a school nurse was really key, and being able to do those little programs in school helped. So school health nurses do a lot of things. You know, they're there to be that support for the parents. They're there for education. I mean, they got put through the ringer when COVID came out. What do we do? Keeping up with the CDC recommendations of their, you know, their environment, their community. A lot of work was done. And then of course, following up care and referral. And then it's not just things like COVID. What if a child, you know, is showing signs of attention deficit, you know, and disrupting classrooms? How do you get that child care as a school nurse, right? It's listening to parents and then finding what we need to do to help the child to be able to understand school and start to enjoy it and stop being such scatterbrained and just really disrupting the classroom because they're frustrated. It's not the child's fault. We got to fix what we can. Again, injury. Kids love to get injured. They get on the bike, forget the helmet, they go running, and they ran into a tree. I mean, it's something that happens all the time. So again, trying to teach children how to prepare themselves in the best manner. We know motor vehicle is the biggest injury of all. They're also saying now recommended rear vehicle seat until 13 years old. My children age many in the back seat that it is safer. Bicycle needs to the helmets now. And the worst injury of all is trampolines. Now, I have a trampoline and a kid behind me in the back, and I'm waiting for him to scream and yell and go bonkers that something happened to him. He's still only 5, he's my grandson's age, but they scare me. My children always wanted it. I would not put one up for them because I didn't want them to get hurt. They were mad at me, still mad at me years later. Now, when you have a child and now they're in school age and they are learning best friends and wanting to go to best friends' houses and then learning best friends' parents and getting along with them, it's hard to let go. It's hard to let them grow and to get their independence, but it's what we really need to do. We need to be there watching, but we need to let them be independent. Again, you are getting them prepared for that day when they're going to move out of the house. So school age disorder, I mentioned it, ADHD is a big one. Again, ADHD is when you don't focus and you go from one task to another task to another task and you don't finish. Now, if we were, as a school nurse, got that child in, as I said, listen to that mother first. Many parents of a child with ADHD have been working with this for many years. They've probably taken away every thing that they have. They're not allowed after school. They have to come in, they have to do their homework. They can't have their iPad, TV, nothing until those things are done to try to help them. So these parents are frustrated. If they've come to you as a school nurse, they need help. So first listen to them, because let them tell you what's been going on and then make your plan of care. So your child has an avulsed, knocked out tooth. The parents are reluctant to reimplant the tooth. Where should the tooth be placed for transport to the dentist? Where? Or a pediatric ER?
A.
Milk.
In cold milk. Yes, it is. So now you can tell everybody if one of your teeth fell out, put it in milk, right? And now adolescents. I think adolescents are a very difficult group of children because they are starting to want to be independent and they want to be able to do what they want when they want to. And that's just part of being an adolescent. They're going from being a kid, a child, now they're growing up to be an adult. And once they're done with this adolescent age group, they will be on their own, whether it's going to college or whether going out and getting their own apartments, getting married, et cetera, et cetera. It is rapid physical, cognitive, social, and emotional maturation. They grow up really, really quick. So we know adolescent child starts with those appearance of those secondary sex characteristics, like the enlarged testes on the boy and the breast buds on girl. And it goes into the Tanner growth, sexual growth, which is in your book to look over what goes on next. And it goes on till about the ages of 18, 20, rarely more than that. My son at ninth grade was 5'7", weighed 145 pounds. He went into the Army at age 19, came home 1 year later. He was 6'2" and 220 pounds. And I was like, yes, the Army fed him, not me. Can you imagine the amount of food this kid ate to get there? They grow so quick in adolescence, many of them. Again, we know that the primary sex characteristics are for reproduction. That's, you know, the sperm, and that's the uterus and ovaries. Now, secondary are things that happen because of the hormone production. We know that voice changes. We hear that mostly in boys, but girls change a little bit, whether you were a soprano and now you're an alto in the choir. That's what happened to me. All of a sudden my voice went down. Hair is going to grow in places I never knew it was going to grow. The breasts get large, the fats deposit changes. And this is just all changing the body. It's not for anything with reproduction. It just, the body changes. So again, boys, testicular enlargement, and then girls, the first pubescent change is the breast buds. And this is the whole big tanners that you can look at, from no breast to big breasts, from no pubic hair to a bush, from, you know, a penis with small testicles down to a lot more. So in adolescence, there is this growth spurt. 20 to 25% of the total height is achieved during this puberty changes. Now, it is said that these adolescents do need more sleep and more nutrition, better nutrition, because they're growing that much. Well, think of you as an adolescent. You're too fat, you need to lose weight, you want to get your A on your test, so you're not sleeping, you're not eating properly, and you're growing like crazy. So it is important for good nutrition at this point. Now, obesity can happen with early menarche in girls, you know, that happen maybe at ages 8 or 9. You might see that because of the hormonals. And then obesity, we don't see it as much in boys. There's no relation. And as I said, voice changes in both sexes. I know, speaking to one of my girlfriend's son, for every year, especially on his birthday, I would make sure I called. They lived in New York, and of course me here. And in 1 year, all of a sudden his voice was down here. And I'm like, oh my God, when did Mikey grow up? You know, and you could see the difference and hear it. Erickson, sense of identity. Who am I? What do I want to be? What part of, you know, the population do I want to be with? Am I the band group? Am I the nerd group? Am I the sports group? You know, am I the everything in black with black nails? What am I? Who am I? They want to be a part of a group, okay? Very important for them. You know, at this point, they're learning sex or understanding the emotional part of it. And what sex do I want? Am I like girls? Do I like boys? Do I like them both? So all of these things are going through this adolescent. So social development, we know that the acceptance by peers is important, and finding those peers that you feel like you fit in. And again, this is pulling you away from mom, and this is giving them their identity as they grow older. Now, they still need the parents there, but not as strictly as they were as school-age children. Now, adolescents are very emotional. They like to be out, like to be with their friends, but then you see this intense loneliness. I'll give you a great example. So you have a girl who has been talking to this boy, and she walked around the corner in school and found her best friend hugging this boy. Can you imagine how that would feel? So now that she has lost not only her best friend, she has lost the boy that she wanted to be with. Intense loneliness. So it's out and happy and around and everything's good, and then lonely. So it's both of these stages. As I said, relationship with parents, it's more of that mutual affection. And we know there's a lot of turmoil in there, like I've just described to you. So, as I said, teenagers want to be able to do what all the other teenagers are doing. And some parents are stricter than others. I mean, my kids on Friday night are not staying out till 2 a.m. when they were 15. Sorry, there's nothing but no good going on at that time, as I used to call it. So there was a lot of tension, let's say, between us. So we know that at about ages of 15 to 17, the conflicts are over that independence and then the control of their responsibilities, okay? They have to know that there are certain things they have to do to be able to get the independence they want. They need to get that grade at school. They need to make their bed, put their clothes away, do the laundry, whatever, take the garbage out, whatever their roles are, responsibilities in the house must be done, and they need to go out. So many times parents need to sit down with their children and make out a plan, a contract that says, this is what you get when you do this. And it has to be agreed by both. And of course, children always want more, but at least it's working towards a mutual agreement. I just said that. So the relationships with peers. We know that peers are really important because it gives them a feeling of belonging and feeling its strength and power. Somebody else is just like me. So you don't feel like you're that weird person out there. Best friends are important, and usually they're same sex. Not always, but usually they are same sex, and they're very important. Now, the thing about best friends as adolescents, you're going to see how they're going to treat their partner for life, how they treat their best friends as an adolescent. They don't treat their best friends well, and they're always doing wrong things to them. It's going to be the same thing in a relationship as they get into their partner for relationships for life. So very important, best friends in adolescence. Now, adolescents, they come into your doctor's office or your emergency room, and you need to have a relationship, be able to speak with them. How are you going to do that? Well, adolescents are people that want to be treated with respect, and they want to be talked to, not the parents. They want to be able to say their piece. How do you do that? Well, first of all, you're going to start a rapport. So I see that you had an earbud in. What music do you like? What's your favorite group? Are you going to college? What are you doing in school? Are you in sports? Do you play band? What is your, after school activity? And this actually starts a rapport. I mean, not those rapid fire questions one at a time, but something to start something. Start talk about, just like we do with the little kids. Build up that rapport first. And in adolescence, we're asking them questions about themselves, okay? Especially many times we have a parent in with a child, and let's give you the example, it's a girl. She's in the doctor's office because she has a urinary tract infection for the second time this year. So you can have the parent walk out and leave you in the room after now you've opened a rapport with this adolescent and ask, questions regarding sexual health. What are they doing? It could be that they don't understand certain things about sex. And we know in adolescence, we need to prevent, things like hepatitis. We need to AIDS and vaginal warts and herpes and all of those things. And this is our chance to speak with them, because many young girls, like I would talk to my mother, they need somebody to ask that is an accurate source, okay? Another thing we see today, earlier than ever, is the different gender roles. You have girls that dress like boys and boys dressing like girls, and that's fine. But you as a nurse, what are you going to call them? Ask the child yourself. So what do you want me to dress you as? I have a stepdaughter who is a girl who wants to be called Ray. This is her gender role that she wants. And I'm like, okay, that's fine. So I asked her, what do you want me to call you? And she says, you can call me Rachie still. I said, okay, thank you. But she's known everywhere else, and that's her name. And, does dress more of the masculine way, and that's okay. But I now have respected her by asking her, and that's you as a nurse. HPV vaccines should be given. They should be given about 12 years old. For girls, they can be given to boys too. Again, nutrition, I discussed it. They need good nutrition, but they're on the go. They take a snack and a bottle of water, pack it in their bags and go. And we know that they need better nutrition than that. So again, if we are worried about this child not with good health, have them do a 24-hour diary. I want to know what food they've eaten to make sure they're getting proper nutrition. Again, adolescents and infants need the most sleep of all the groups. Infants are growing quick. What did I just tell you about adolescents? They're growing really quick. So they're the groups that need the most. It doesn't mean they get it. And they don't get it because they're out, they're busy with their buddies and them, and they're trying to do their schoolwork to get in the best college, et cetera, et cetera, et cetera. Again, we always want to make sure that they have plenty of exercise. They take care of their teeth, they floss their teeth, and that's important. Sexuality education, we know that today TV has more sex on it than ever. I mean, think about back in the 50s with Lucille Ball. They were the first TV show to have parents sleeping in the same room, and they had both a twin bed of their own. They didn't sleep together. And that was a huge deal that they showed that. It was like, oh my God, they showed the bedroom. So today we see everything on TV. So adolescents can get, educated by this. Is it the proper? No. So they should be getting information from parents. But as I said, my mother didn't tell me nothing. So it's great to have school nurses, Planned Parenthoods, to get that good education. School nurses are very valuable right now. Many of them, have seen them for many years and will open up to them. Again, safety, promotion, injury, motor vehicle. They're driving cars now, and that could be really scary. And then, of course, we know that just being in cars, that causes injuries. Firearms, they're getting inquisitive. They're picking up things. Sports injuries, they are doing sports where they're doing, for instance, think about the Olympics. How many repetitions of these exercises they do to be good. And now they're stressing all their muscles and tendons, and these injuries are important. Making sure they have proper equipment so they can prevent these injuries, so important. So Matt is 14, he's always eating, 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 although his weight is appropriate for his height. The best explanation is why. Anybody?
It's normal because of the increase in body mass.
Yeah, because remember, this guy is growing 25% of everything. So, of his height and weight. So very important. So that's your school age and your adolescence. So who wants to win the Kahoots today? Who wants to win? Nobody? Hands up, me. I win. Okay. Here we go. I think there's another 50 something of these. All right, let's go ahead and get started so we get it done tonight. I think we'll be a little bit earlier today. You've been patient. Week 1 was a little bit bigger. How does the onset of pubertal growth spurt compare in girls and boys? So we know that boys are stupid when we're about 7th grade. So it's about 2 years the girls go through puberty before boys. Then that's when boys are stupid. I remember saying it as a kid. He's stupid. At what age should a parent expect to have major conflicts over independence and control with their child? And you know that the adolescents want to do whatever they want because their buddies and them can do it, or they say they do. But it's right around the ages 15 to 17. This is when they're having those conflicts over independence and control. And this is when parents and child, if the child will listen with you, make some sort of contract, something to work with that's workable for both of you. The onset of puberty is characterized by what? Excuse me, my sinuses are draining on me. And its testicular enlargement gets bigger, okay? That's number 1, okay? That's a question you'll see. SEs, NCLEX is always, what starts puberty? What will you see first? Signs of onset of puberty in girls. And that's the breast buds. Very good.
It kicked me out, so I'm just going to play along.
That's not a problem. Thank you. The source of injury, whether intentional or unintentional in adolescence, is associated with what? adolescents are all into body image and looking good and their hair good and their clothes right and their weight right. And, there is these intentional injuries, suicide. Some teenagers can, and you never take an adolescent saying, I feel like killing myself. You take it seriously every time. But, those unintentionals are the motor vehicle where, they're driving or they're in the car and there's an accident. If a parent feels uncomfortable talking about sex education, who's a good resource? The school nurse is the best. I wouldn't say going to an older brother and sister. You don't know if they've been given the correct information. And it is actually the best to get accurate from the very beginning. A 9-year-old's friend tells him soccer is dumb and he should play baseball. Why does he say that? We know that same-sex peers are very important and they want to please each other, okay? So if your best friend says, I'm gonna play baseball, why do you wanna go soccer? That's stupid. Even if he wants to play soccer, he will switch to baseball to be with his best friend. It's not uncommon at all. During a mission, the father of his 16-year-old says, we are Buddhist. Culturally competent care includes what? So when you don't know what a child wants to be called, what is in a culture that you don't understand what you need to do, you ask the client, ask the parents. They will be so appreciative that you did ask, because many nurses don't, and they just do what they want. And as I said, Buddhists are probably vegetarian, probably. I don't say all of them are. So, or maybe they don't want a male nurse taking care of their daughter. Ask the parent, ask the child, and they'll tell you what you need to do. Keep everybody happy. I want no complaints. When teaching sex education and contraceptive for adolescents, what should the nurse consider? So you're the school nurse and you've had an adolescent come and you have a class about sex education and contraceptives. What would you do? How do you do this the best? So the thing is, you can teach sex education and contraceptives, but you need to give them written information, no opinions. I mean, I'd like to say as an adolescent, you shouldn't have sex. Well, we know that's not going to happen today. If they want it, they're going to have it. So giving them accurate information and giving it in the written form, all that does is, makes that information more understandable. I'll multi-select. The management of adolescent obesity should include what? Well, you need to have a 24-hour diary to know what is the kid eating, but also any diet should include some favorite foods. Like you can have your ice cream every Sunday, have a scoop. You can't just take away everything. Diversional activities, those only work for younger kids. and using nutritious foods, the method of reward. They don't care if it's nutritious. They want one of their favorite foods as a reward. And that's why you incorporate them into the diet. Infants go through predictable sequence of growth and development. This is called what? Now, I do throw some questions from last weekend that are important to make sure you're understanding it. So predictable sequence is sequential trends. Makes sense now, doesn't it? These are important concepts that we go through. We know it's going to go in a certain way. Which of the following drugs is the most common drug of abuse in the adolescent population? And because you can get it easily, it is alcohol. I know that I didn't really have a lot of alcohol in my house. I'm not a big drinker. We'd only have it for parties. But I know that my girlfriends would tell me the children would go empty it out and fill it up with water and put it back in the cabinet. And then you have a party, pull out the bottle, and they're like, put a little more. I don't taste any alcohol. Well, it's because it was all water. And that's what the adolescents do sometimes to get it. Which benchmark serves as the ending period for the middle year period of development? So what ends school age? And it's the beginning of puberty. So school age starts with baby teeth, ends with full teeth, and then it also ends with that onset of puberty where you're starting to get the breast buds and the testicular enlargement, okay? An example of indirect bullying would be if, I mean, we know kids can be mean and they can bully and be, really cruel. Today they can do it in so many different ways. Indirect bullying. And that's when you do that social media, those Facebook things, and they really can be really cruel. In fact, some of them can really mentally disturb a child for a long period of time. And it's called actually suicide because of some of these things that have been said. Which action would improve dental health in the school age child? Remember, very important to take care of teeth of a school age child because you are getting your permanent teeth. All the babies are coming out and we are getting our permanent teeth in. So we need to take care of those teeth. So we're going to start flossing, okay? Flossing really helps dental health. Of course, brushing morning and night, at least for these children, would be good. And Meg's on fire. Generally, the earliest age at which puberty begins is what? I'm not talking about precocious puberty, which is really early, just normal. And it's 10 years in girls, 12 years in boys, and that's right around, well, it's 5th grade for girls, 5th, 6th grade, and then about 7th grade is when those boys start changing. And Meg's still on fire. An 8-year-old girl says that she has cancer because God is punishing her for being bad. Why does she think that? School age girl. It's absolutely a common thing. Remember I said that the little kid who came into the emergency room with an appendicitis said that he hit his sister the day before and God was punishing them. This is what they believe. Absolutely a common thing to say. And if you can imagine me telling that child before surgery that it wasn't God who did that, because now they feel they're going to bleed out, their insides are coming out, and that they're going to die because he hit his sister and God's punishing them. And I said, well, God isn't punishing them. So now they went to surgery realizing, okay, I'm going to be okay after surgery. 5-year-old needs a chest x-ray. Well, explanation is the best. So again, the technician is going to use this large camera. It's going to take a picture and we're going to see your insides. And it's really neat to take that x-ray when it's done and show these children their insides. They really love it. They love to learn. And Sean went on fire. How do you get an adolescent to open up about their sexual history? Again, just like you do with the younger children, start talking about their Batman shirt and their cute freckles, whatever. In an adolescent, we're going to ask them, so did you see the newest movie out? You know, what music do you like? Start social history first. What did you do Saturday night? Did you go to the movies? Did you go bowling? What'd you do? And then it'll break the ice and they'll start talking more about their sexual history, be more comfortable doing that. Very important with adolescents. How can you get an adolescent to be more receptive to talking about their health and sexual exploration? So you're going to have the parents leave the room, and you do not have to tell the parents what that child said unless their behaviors can be harmful to themselves or others, okay? And you're going to ask direct questions too. You're going to say, so have you this? Have you that? And, you know, once you've broken the ice talking about social activities, etc., they will answer them. In fact, some of them like to try to shock you with what they say, and I won't act shocked. A multi-select. When educating adolescents about risk for HIV, hepatitis, what would you include? So abstinence, okay, fine. You're not all of them going to do it. Hand washing is actually important. And of course, condoms for sexual intercourse. They also say prevention of urinary tract infections, that the girls should urinate as soon after intercourse as possible. And it will decrease the incidences of urinary tract infections, just for another bit of information. A child is knocked out tooth. Where should the tooth be placed for transport to the dentist? Again, it goes into cold milk in a baggie, a jar, whatever, bring it, and they can reimplant it. And many of them do get in there and they do adhere and stick there, especially if you have the whole root. If you crack it, there's nothing that can be done. But many of them come the whole root, the whole tooth come out. A nurse planning care for a school-age child should know which thought process is seen. And that's the ability to conserve. And let me describe this well. Many parents go shopping on Friday or Saturday and they buy groceries for the week. Many parents will buy a child a snack for after school. So let's say you got a little, and this is what I did for my kids. I'll give them a box of Little Debbie's. There's 10 and they all can have one after school as a treat. Now, if they eat 2 today, tomorrow they have none. Or by Friday, they don't have any more. That's the ability to conserve. Or they've got their uniforms to wear and they have to do laundry. They know how to conserve their uniforms to make sure they have enough to go for all week long. That's the ability to conserve. And Carly's on fire. What stage of Erickson would you use for a school-age child? Remember, school-age children love to do things and do them well and have the peers tell them, what a great job you did. Wow, that was awesome. But they are also upset if they can't do it anything well, whether they're that, child who's gawky, who can't do sports, they feel inferior. So industry is the ability to do something well. Inferiority is when they can't master a task that maybe some other ones do and they just can't do it. So industry versus inferiority. And Kristen's on fire. A multi-select. Anorexia nervosa is characterized by now, I don't cover this in the lecture. It is an eating disorder. There's 2 types of eating disorders in adolescents, and it's anorexia nervosa and bulimia. Anorexia nervosa is when you put nothing in your mouth. You're afraid to drink. They're afraid of weight gain. They feel that they're not skinny enough and they don't put maybe a slice of lettuce in their mouth. Now, bulimia, conversely, they eat so much food, but they vomit it up so they don't get the calories. Now, how would you know which one was which? Well, anorexia nervosa still have beautiful teeth. A bulimic child is going to have rotten teeth because of the vomiting and the gastric juices, okay? That is the difference that you will see. And one who's been doing bulimia, which is purging a long time, you're going to see that their teeth are going to start looking, rotten, and they're eaten by the acid that the stomach has produced, okay? That's the difference. How do you know if you suffer from bulimia? And again, it's binge eating, and I'm telling you, they can put a lot of food in them. It's very expensive for parents to have all these foods in the house for these children. Okay, come on. Did my computer just freeze? There it is. Hold on, guys. All right. Sorry. This did it to me earlier today. There we go. A leading cause of death from unintentional injuries in children is and we know unintentional is your motor vehicles. Ashley knew that one too. Adolescents are somewhere between a kid and an adult, and it becomes very frustrating. They're confused. They want responsibilities, but they cannot do, they want all the privileges with no responsibilities, and it's a very confusing time of life. I do not ever want to be an adolescent again. What is an adolescent's heart rate? So somewhere 55, 90. Now, adolescents tend to be more active, so their lower limits are usually lower than the adult, and so is the upper limit. 60 to 120. 120 is way too high for an adolescent, unless they're working out and running. That would be about 120. Now, tips on fire. When talking with an adolescent regarding personal health concerns, which is most important? Absolutely. Let them express their feelings, be open, be honest. They can ask whatever questions they want. A parent says the infant puts everything in their mouth based on Freud's theory. You would respond to the parent what? You know, when you think about Freud, remember Freud's all about sex, all about oral satisfaction. That's part of Piaget's beginning, the sensorimotor, but Freud is all oral. That means biting, sucking, chewing. This is the way they find themselves around the world. The textures, the tastes, everything in the mouth. In addition to injuries, the leading cause of death in adolescents ages 15 to 19 years are what? And it's homicide, suicide. It's, you know, adolescents tend to explore, get into wrong places, and they tend to, whether it's motor vehicle or usage of guns, you know, have this homicide that goes on, but also suicide, because it's this intense loneliness, this body image, this needing to be needed by peers, to be accepted. And when they're not, it's intense depression, which could cause suicide. In school age conflict, versus industry versus inferiority. What does industry mean? Industry and inferiority. So that industry is when they do something and do it well, okay? This, when you talk about Erickson and we talk about what he's talking about, he likes to do things that peers look at that child and say, wow, that was awesome, whether it's math, spelling, doing a sport. And then the inferiority is when they can't master a skill, a task, and they feel less than. So doing it well and then not doing it well. Industry versus inferiority. At what age does intuitive thought start? This is green, and look, that is green too. This is round, and wow, that is round too, intuitive, putting them together. And that is about 5 to 7 years old, right at the beginning of school age. At which age group prefers to be with members of their own sex? Same-sex peers. And that is the school age children, the latter group, where they really want same-sex peers. That's all school age is same-sex peers and their best and their friends. It's very important to them. And remember, those same-sex peers can sway them instead of going out for band to go out to play in activities, sports. It's, you know, they're very influential. Which age group would have a tendency towards eating disorders? And that's your adolescents. Yes, they are. Because why? They're into body image. They want to feel good about themselves or what they feel that their peers would think would be good. True or false? Home support is invaluable to the adolescent. Do they need mom and dad? And the answer is yes, they do. Because what something happens on the outside and they need somebody to comfort them. Who's going to comfort them? Mom and dad. They still need that support. They still need mom and dad to help guide them along, but sort of subtly, not like in the highlight, like you were with the school age. Contraindication to administering the varicella vaccine to an adolescent. Well, let's look at varicella vaccine. What is it? It is a live vaccine. It doesn't matter what age, child or an adult. This is something you need to know before giving this vaccine. Are you immunosuppressed? Are you taking a corticosteroid, a steroid? You cannot give live vaccines to immunosuppressed people. Does that make sense now when you look at that? These are questions you will see again, especially on the NCLEX. I've heard that one given. To improve adolescent health, adults must increase health enhancing behaviors such as what? Adolescents to be healthier, what should they do? So good food, they need to be exercising when they can, then they need to sleep. And we know that a lot of these things they don't do because of time, social activities, you know, they're getting ready for school, getting those A's. What clinical findings does not indicate an adolescent may be suffering from anorexia nervosa? Does not indicate anorexia nervosa. So remember, bulimia has the teeth that are decaying. When you talk anorexia nervosa, it's just like hypothyroidism, dry skin, tolerance to cold, constipation. This is all anorexia nervosa, but the teeth is bulimia. Good. The risk of depression in transgender children is what? Absolutely increased. And, you know, they need that person to be there and hug them and say, you know, what's wrong with you? There's nothing wrong with you. You just need to be you, period. A 14-year-old in the ED after a biking accident, how should the nurse interact with that adolescent? You know, I've had children come in on stretchered backboard with the collars on, taped down, and, you know, they've been hit by a car out on the street trying to cross. How am I going to make them better as they're there just freaking out? Well, I'm going to tell them what's going on, and I'm going to answer every question they have. Yes, if we can have that adolescent, but parents, but many of them come in and the parents come in later. That's what usually happens. They're helicoptered over or ambulanced over. The parents are later. But as a nurse, you're going to act like that parent. You're going to be there to help and guide them through this moment, because everybody's going to touch them all the way. Quickly, they're going to be cutting clothes off, starting IVs, doing x-rays, and it could be scary. Cooperative play. What is that? So cooperative play is when two children are working together because they have a goal, whether it's in the sand, making sand castles because they want to make sand castles in a moat when they're done, whether it's playing a board game and in the end, whoever, you know, finishes first wins. Cooperative play is two kids working together because they're reaching a goal. There's an end to the game, somebody wins or something happens that they're finished. And Ash is on fire again. What does moral development involve? Well, who's moral, right? Kohlberg? What does Kohlberg say? So Kohlberg is about right and wrong and consequences for being right, which are nice, and consequences for being wrong, which could be quite a punishment. Telephone ringing, sorry. Developmental milestones are important to observe because what? So if a child is not up to where they need to be, we can do early intervention, or we can prevent more things from not going forward and bring this child up to be the best they can be as a child. Very important. An example of, let's say a 9-month-old, you take their hands and you pull them up and their head falls back, called head lag. They should be able to hold their head up by about 3 months old. So something's wrong. Let's investigate. And maybe this child needs physical therapy. So it's something that we would start early intervention. And Kristen back on fire. Lymph nodes in children with normal findings should look like what? You should not be able to feel any lymph nodes in any child who's healthy. When they're sick, that's when you're going to find them. The right second intercostal space landmark of the heart is called. Now, there are the apical, the mitral, the aortic valves that you can listen to depending on where you put that stethoscope. Take you back to health assessment. Which one is it? And that is your aortic valve, something you need to look at because this is part of the assessment process in the child. Sean is back on fire. Which nerve controls critical movements of the tongue? See that little baby there is sticking the tongue out? The glossopharyngeal, yes, very good. Central nerve, number 9. What type of breath sounds do you expect to hear over the trachea? Over the trachea. Remember, I've talked about there's upper airway and you hear all the junk and garbage in their nose because of big adenoids and you hear all that garbage. And that's bronchial type. When you want to hear breath sounds, you have to go lower into the lower lobes and all the lobes of the lungs to be able to hear lungs. Many of these children, if they're old enough to tell them to cough and they could get rid of this mucus that's making noise, then you'll hear better sounds. But over the trachea is when you're going to hear bronchial sounds. Depriving a child of food, clothing, and shelter is a definition of what? And that is neglect, absolutely. Which of the following immunizations is given in the adolescent stage? And that's the HPV. And that's a very important vaccination to give because it can prevent, herpes on these children, vaginal warts. So it's a good, well, vaginal warts, it's a great thing to have and prevents, cervical cancer. ADHD most likely involves which of the following? Attention deficit hyperactivity disorder. So it's when they can't pay attention, all of a sudden they get up and go somewhere else, do something, and they're very hyperactive. And again, remember, this is a very difficult thing to help parents with. And again, sometimes they'll go to the school nurse for help, and the school nurse can be very instrumental. Many of these parents have gone through a lot to try to help a child by the time they're in school. So making sure that we listen, and see what they've done already. Don't ever assume they've done nothing because many of them done quite a bit already. And last question. Adolescents typically place blank on peer relationships. And that's very high value. They want to be a part of a group, and that group that praises them, it's so important to them. So let's see how we did. Number 3. Kristen, good job, Kristen. Good job. 2, Meg, good job. You said you're gonna do that. Number 1, Ashley, good job. 4, Tiff and Sean. Good job. What I want you to do is sign your attendance attestations. Please get them done. Very, very important. I've said it before. I'll say it again. Make sure you get it done. Is there anything I can help anybody else with today? This is a good class. We got over just when I should for you. Remember, I'm doing a review tomorrow night at 5:30. If you cannot make it, again, you get all the recordings. Again, I'll post it on Professor Bogart Pediatric Nursing in YouTube. I'm really excited that I figured out how to do a YouTube channel because I'm not a technology person and it works. So that's even the best. So it is
I have
there
a
for
question.
you. Yes, Tara.
So for the ones that are, from when we do our exam, I live like a little over an hour away from the school. And so I'm already going to be at school to do my med surge class.
Mhm.
Is there any way that I can go ahead and just do my exam there at the facility?
Not a problem. In fact, if some of you want to do it at school and want to do it with a school person proctoring you,
Yeah.
just let me know who ahead of time. Not a problem at all. Or if you're at school and you can Zoom me and use your computers to do the exam, I can do it either way, whatever works good for you. Not a problem, not a problem. Great question, Tara. Thank you. Anybody else? Goodbye. Have a great evening. Thank you so much. See
Thank you.
next
Have a good
week.
night.
Study
Thank you,
hard.
Ms.
Ask
Bogart.
me any questions. I'm here for you.
Thank you, Ms. Bogart.
Thank
You're
you.
welcome.
Ms. Bogart,